February is Heart Health Month, and tonight we're going to talk about blood pressure. Whenever I was first a nurse in nursing school and right as I got out, blood pressure was known as the silent killer. It still is, but I don't feel that it is as prominent anymore because everyone gets their blood pressure checked, they're on medication. It isn't as big of a problem as it used to be. So that's a great thing, which leads me to my next question. When have you had your blood pressure checked last? And do you know your numbers? What is a normal blood pressure for you? The American Heart recommends that it is 120/80 or less. And if it is not, then you can discuss those things with your doctor or your nurse practitioner or your PA. You need to discuss lifestyle modifications for one, and for two, the possibility of medication. So lifestyle modifications, cut back on the salt, the caffeines, the sodas, processed foods. You can do some exercise, get out and walk. 30 minutes every day will definitely help. Lose a little bit of weight. Sorry. All the things, to live healthy. Because if you watch, your blood pressure is going to creep up along with your weight. And those two things kind of go hand in hand for a lot of older adults. So we don't want to be a statistic, and you do not want to have a silent killer. They call it silent killer because you just learn to live with your high blood pressure. You have it just slowly, gradually increases as our weight increases and our unhealthy choices increase. The blood pressure increases as well. So I had that happen to me myself. So that is why 2 years ago I started in with all the healthy things, and I have lowered my blood pressure. It did not get to even pre-hypertension stages, but I just noticed myself because I kept an eye on it. And it was slowly creeping up. Each year I would go for my physical and the doctor would tell me the numbers, and I'm like, a little higher than last year, a little higher than last year. So you definitely want to be keeping track of that, because you can make those changes yourself and change your outcome. So definitely want to discuss that with your doctor. And if you have to go the route of medication, it's a $4 pill at Walmart. So it isn't like it's a huge expense out of your pocket. You can get the $4 prescription at Walmart. Lisinopril is one that they usually start you out on. It's a simple, quick little fix. And of course, diet, lifestyle, all of that is the main thing. But February is Heart Health Month, and we're going to hear more things about that all month long. So stay tuned.